Welcome to Learning Unit number 5. In this learning unit, we're going to be talking about hospitals and other healthcare organizations, about their need to truly build and maintain strong linkages with community stakeholders. And that's in order to ensure that the needs of vulnerable populations are supported. We're going back to the social determinants of health, and we're looking at healthcare disparities as a quality and safety priority. We know that social determinants of health is more population focused, and when we're assessing our patients that we're serving, we're really looking at almost the same, but they're using the terminology health-related social needs. So as we assess for health-related social needs, this is going to better enable vulnerable populations to access care and to access quality of care. And so, although our topic is called accessing and paying for healthcare, we're taking kind of a different focus. We know that there are healthcare disparities. There are populations that have health-related social needs that are not being met. We know that these disparities are impacting on health outcomes, negatively impacting on health outcomes. So we're going to take the focus of what can hospitals, what can healthcare organizations do to assure the access of quality care for all of their patients. And so we start by looking at the need to build strong community relationships and to help communities to develop innovative ways to use what we always have, limited resources, to transform care for changing communities. We're going to focus on the community benefit. The community benefit is an obligation of most, not of all, nonprofit tax-exempt hospitals. The community benefit requires hospitals that are nonprofit tax exempt, which is the majority of hospitals in the U.S., to complete a community health needs assessment every 3 years and then do something with that assessment, have an intervention or initiative to decrease these disparities. So it's asking hospitals to look outside your walls, engage new partners, and instead of just focusing on the community benefit of providing charity care. So we're going to look at community engagement, public policy, and really ways that nurse leaders can be involved in health-related social needs and assessing these needs. So we're going to do a couple of things. First of all, you're watching this video, and I'd say pay special attention. I'm going to try to go as fast as I can. We're going to have readings. I'll come back to these readings in a minute. But the first thing that's an easier, more fun thing to start with is the spent scenario. So this was developed by an agency that serves over 6,000 people every year who are living in poverty and often are homeless. So it's giving you that experience, a bit of the perspective of what it means to have to be homeless and to be challenged as far as having insufficient funds to make it through the month. So as you go through this, don't make it a long, lengthy process. I think a couple of students have gotten kind of caught up in it. So this isn't a huge activity. I don't want you to be spending more than probably about an hour in going through it, jotting down your answers to these questions, and then posting that as your discussion board. So I'd like you to kind of move along quickly with this. I want you to get that perspective, but I don't want you spending oodles of time. So you can see the questions here that I ask you to jot down as you're playing the game is the answers to those. And then you're going to give us a summary. You're going to share with us your experience of going through this game. And you don't have to reply to anyone. There is no APA formatting. You're sharing your experience of the game. You're also, as we've been doing weekly, focusing or doing your journal on loss. And for this week, describe 2 coping mechanisms that you've found helpful. You're also going to be doing your vulnerable population assignment number 4, which is developing a problem statement. We'll go over that in a minute, but that's going to take us back to the readings. So when you get, I'm just trying to make that a little bigger. When you get into these readings, you're going to see that there's the chapter readings, and that's chapter 6, community engagement and partnership. That's in your ebook, and this is just accessing it like we provide you every single week. So you're going to read that chapter. Then there are 3 different readings that you're going to have. The first is about the community benefit. So over 50% of hospitals are designated as these nonprofit, non-governmental community hospitals. And that makes them tax exempt. So they do have an obligation to the communities that they serve. And this is mandated and has been for a long period of time by the IRS. Now they must also conduct a community health needs assessment every 3 instead of 5 years. So I want you to really dive into, make sure you can speak to what the community benefit is. And then thanks to Sarah for supplying this earlier in a different learning unit, there is a new Joint Commission requirement to reduce healthcare disparities. So I'm asking that you look at this, and let's do it together for a minute. I think we have some time. And in this report, this is as of January 2023, there is a new and a revised requirement to reduce healthcare disparities. And who needs to follow this is given here. And it goes on to give you a nice introduction about what they're going to now require and why. And then it provides us with 6 elements of performance. So EP1 is that each organization needs to designate an individual or more than one to lead activities that are going to reduce healthcare disparities. See if we can get it any bigger. Healthcare disparities for the organization's patients. So sounds like a pretty cool role, does it not? As a nurse leader, might be one that you end up taking on. So, and then there's 6 of them. But what I wanted to get to was EP number 2. EP number 2 says, according to the Joint Commission, the organization needs to determine which health-related social needs to assess. And it can be more than one, but they give you examples of these health-related social needs. So it's saying, okay, we need to assess our patients, whether they have things such as access to transportation. And these are recommended. Not each one is required, but they're recommended. Do they have access to transportation? Do they have difficulty paying for their prescriptions or bills, medical bills? What is their education and health literacy level? Food insecurity and housing insecurity. So again, look at those closely. Access to transportation, payment for prescriptions or medical bills, education literacy, and food and housing insecurity. So you can go then on and read the rest of this, but I want to go on now to the next and final reading that you are required to do this week. This is just a two-pager. It was completed in 2017. It's written by the American Hospital Association. And really, I ask that you spend a little time in looking at this, and I'll show you where. So this is from the Centers for Medicaid and Medicare and Medicaid, CMS, as far as ways in which we can, as healthcare professionals, address underlying social conditions that affect our patients. So we can screen, find out this information. And that's the piece that I want to stop at right here. So this gives you the determinants of health. But remember, we're looking at more individual patients instead of populations. I guess you can look at it either way. But when we assess, when we ask a patient for information, we usually do that with a screening tool. And that is asking them about their health-related social needs. All goes into is very similar. But where I wanted to get you to, if we have just a few more minutes, is this tool that the CMS put together. It's 10 questions. It's a screening tool that can be used by different healthcare organizations to meet the Joint Commission's new requirement. And so we're going to open that screening tool up. And where I want you to go is the blue chart here. So in this, there is, similar to the Joint Commission, there are questions that are written out about housing instability. So the Joint Commission said, yeah, that's a great place to start, housing instability. And when you're talking about the Northeast, such as Erie, Pennsylvania, inadequate heat is huge, but that's one of the questions about the place where you live, and do you have housing? So you can check out these questions. Food insecurity was another one the Joint Commission recommended we assess our patients. And transportation needs, especially in rural areas. But you can see the actual questions that are beneficial to ask. Now, the Joint Commission then goes on to say about education and health literacy, and if a patient has difficulty paying for medications and medical bills. This one veers off. Now, remember, the Joint Commission didn't say you had to ask for those, but questions such as those. So the CMS had come up with utility needs as far as electric, gas, and oil and water. Has it been threatened to be shut off? Yes, no, already. And then this one goes deeper into personal safety. So as far as physical harm, verbal abuse, threatening, those kind of things. But I wanted to show you how at least the first three were exactly the recommendations of Joint Commission. And I'm sure utility needs and interpersonal safety would also be, they would agree that that is important as well. So let's go back if I can get there. And the last thing I want to do is to go back to the final objective of the week. And now this is your vulnerable population assignment, developing the problem statement. 3-page paper based on your previous work. Be very clear now in defining who your population is. Did you make it more specific? Healthcare problems faced by your population. One example of a concern that your group is at risk for experiencing and the implications for nursing. Why it's important to address this. Now this one I've changed. You're given another option. It's either describe 1 or 2 current public policies that are relevant to the concern you identified, which is right up here, or what I'd really like you to do is briefly describe how the Joint Commission's requirement to decrease healthcare disparities can or will apply to the concern you identified. So that's it for this week. That's enough for this week. And it is an extended week because we follow with the Thanksgiving holiday. So check out those dates and have a good, happy Thanksgiving with your family or loved ones.